Slowly and surely, one sign at a time, your body is giving you messages that something is not right. The messages are so subtle we don't even notice them. It takes up to 8 to 10 years for insulin resistance to fully develop into type 2 diabetes. The earlier you find your blood sugar levels are higher than normal, the easier it will be for you to reverse some of the signs and symptoms and prevent complications from developing. Fatigue. This is one of the most common signs. You just feel worn out. Increased urination. As the level of sugar in your blood rises, it spills over into your kidneys. Water is pulled out of your blood circulation and then more urine is formed. Excessive thirst. Thirst naturally follows as the amount of water in your blood decreases. Your mouth feels dry, you feel dehydrated. Weight loss or weight gain. 90% of people who go on to be diagnosed with type 2 diabetes are obese due to the influence of insulin in the bloodstream. 10% who are diagnosed are slim. Weight loss is usually associated with type 1 diabetes. Brain fogginess, the inability to concentrate and poor memory often appear. Sleepiness, often shows after a meal, especially one with a high carbohydrate content, e.g. pasta, potatoes or even a sugary dessert. Low blood sugar. Everyone has brief periods of high and low blood sugars. It's when they continue for long periods and are accompanied by some of these other symptoms that it's not classed as normal. Depression. We all feel down sometimes. It's when it doesn't go away and you feel hopeless that it's a problem. The brain's chemistry is altered by the blood sugar levels. Bloating. Gas in the intestines comes about from the high amount of carbohydrates in your diet. Usually antacids don't work. Blurred vision. This occurs due to the rise and fall in your blood sugars. Your lenses do not adjust quickly enough. Urinary tract infections. High blood sugars interfere with the body's ability to fight infection. Loose teeth. Gums become red and swollen due to infection, then gums recede from your teeth. Elevated blood sugar levels are not just a sign of diabetes, they can relate to a range of other conditions. Type 2 is diagnosed when the fasting level is above 126 mg/dl, 7 mmol/L. What to do? Working with your healthcare provider to get to the root of the problem is absolutely vital. He can determine if you have type 2 diabetes by ordering a fasting blood glucose test or 2-hour oral glucose tolerance test. It is important to know many of the risk factors of type 2 diabetes can be reduced or even eliminated with some simple lifestyle changes. The good news is that losing just 5 to 10% of your weight can significantly reduce your risk of developing diabetes.